Aloha guys, Dr. Thomas back coming at you once again. Yes, you'd be disappointed if I wasn't here. Okay, we're talking about Unit 25, Chapter 25. Diuretics and medication used for urinary system disorders. Diseases and disorders of the urinary system involve kidneys, ureters, bladder, and urethra. In other words, all of it. Approximately 20 million Americans are affected by kidney and urological diseases. That's a lot, guys. Leading cause of chronic kidney failure. Number 1, type 2 diabetes. The leading cause. Why diabetes damages the little delicate tissues in the kidney. High blood pressure. Same thing. Blows out and tears up the glomerular apparatus and all. Glomerular nephritis, which is a disease of the glomerulus. Bowman's capsule. Okay, diuretics. Diuretics are water pills. Number 1. You need to learn that right off the bat. Diuretics is what the public calls, yeah, I'm on water pills. Decreased reabsorption of sodium chloride salt by the kidneys, increasing salt and water excretion in the urine. Remember, I've said before, guys, water follows salt or sodium in or out of the body or in or out of the cell. Reduced fluid retention prevents edema, which of course is swelling. Uses: CHF, congestive heart failure. Why? It can't keep up with that fluid, so if you can diminish some of the fluid in the system, it takes some of the strain off the heart. Hypertension, high blood pressure, same thing. The more fluid, the more pressure. Nephrotic Syndrome, which is a kidney disease. Chronic renal failure. Idiopathic edema. What's the word idiopathic mean? Of unknown origin. You're just swelling up for some reason. Diabetes insipidus, remember? A lack of vasopressin in the posterior pituitary. Glaucoma, the drainage of the anterior chamber of the eye is impaired in some way, and diuretics are used indirectly to help that. Thiazide diuretics inhibit sodium chloride reabsorption in the distal tubule, block chloride reabsorption in the loop of Henle. If you remember your kidney anatomy. Uses: edema, hypertension, diuresis. Adverse effects: weakness, hypotension, low blood pressure, diarrhea, vomiting, constipation, glycosuria, sugar in the urine, which should be common in diabetics, vertigo, electrolyte imbalance, increased blood sugar. Loop diuretics affect the loop of Henle. Inhibit reabsorption of sodium chloride in proximal and distal tubules and in the loop of Henle. Use as adjunctive therapy for acute pulmonary embolism. Guys, pulmonary embolism, PEs, when you get a blood clot or some other, usually it's a blood clot, but it can be a glob of fat from a fractured femur or different things. And it ends up in the lungs and clogs up the vessels, and it's very commonly fatal. It's very, very serious. Adverse effects: weakness, low blood pressure, diarrhea, vomiting, constipation, glycosuria, which is sugar in the urine, vertigo, electrolyte imbalance, thrombophlebitis, which is blood clots and irritation, inflammation in the veins, usually of the legs, increased blood sugar. Potassium sparing diuretics. Why? Because sometimes the person has a diminished amount of potassium also. Cause increased amounts of sodium water be excreted while potassium is retained. Use as edema, cirrhosis, congestive heart failure, hypertension, hypokalemia means low amounts of potassium. Adverse effects: gynecomastia, that's little formation of like little boobs in men. Cramping, drowsiness, urticaria, which is hives, irregular menses, menstrual cycles, hirsutism, like a woman growing facial hair, gastritis, elevated potassium levels. Osmotic diuretics increase osmolality of plasma, glomerular filtrate, and tubular fluid, increase excretion of water, sodium, chloride, and potassium, prevention of acute renal failure during trauma or prolonged surgery, increase cerebral spinal fluid and intraocular pressure during surgery or disease, reduction of intraocular pressure in acute glaucoma. Adverse effects: urinary retention, marked diuresis, thirst, dizziness, thrombophlebitis, hypo or hypertension, loss of hearing. Carbonic anhydrase inhibitors. Promote reabsorption of sodium and bicarbonate from proximal tubules. Why? Water follows sodium, man. Blocks action of carbonic anhydrase, reversing hydration of carbon dioxide. Increases excretion of water, sodium, and potassium. Uses adjunctive therapy. When it says adjunctive therapy, that means, guys, an additional therapy to the main one that's being used. Of open-angle glaucoma, secondary glaucoma, preoperatively enclosed angle glaucoma. Adverse effects, ataxia, which is like you having trouble walking, tremors, tinnitus, ringing in the ears, headache, urinary frequency, renal stones, kidney stones, renal calculi are kidney stones. Urinary tract antibacterials. Urinary tract infections, guys, are quite common, more common in females. Sulfonamides, a drug of choice for treatment of acute uncomplicated UTI. UTI, of course, is urinary tract infection. Ear infection, meningococcal meningitis, infection and inflammation of the meninges. Inclusive conjunctivitis. Irritation of the conjunctiva is the lining of the eyelids and all. Bacteriostatic effect on both gram-positive and gram-negative groups of bacteria. Bacteriostatic, now again, would mean slows the development of it. It doesn't kill it. That would be bactericidal. Urinary tract antiseptics. Not usually the first choice of drugs to be used. Used most often in patients, there should be 2 words, who are intolerant or unresponsive to first choice antibiotics for different reasons. Inhibits growth of bacteria. See table 25.3, antiseptics. Again, guys, anytime it refers you to one of these tables, please look in your book and take a moment to look at that stuff. Medication used in the treatment of endocrine disorders. The pituitary, located at the base of the brain, the cella turcica. Master gland regulates other glands. Overproduction, and that, what they mean is growth hormone. Gigantism or acromegaly, often caused by a tumor. Usually it's a benign tumor, guys, but because it grows, it makes too much growth hormone. Treatment, radiation, surgery, chemotherapy. Underproduction of growth hormone. They really need to say that there because that's what they're talking about. The anterior pituitary, guys, produces like 6 or 7 hormones and the posterior 2. So, you can't just say the pituitary and then start talking about problems with growth hormone because that's what this is specifically. Underproduction of growth hormone, or human growth hormone, is often called, is dwarfism. Poor function of thyroid, gonads, or adrenals, treatment, medication. I don't know a lot about this, guys, but if they can treat children that have this sort of problem before their skeleton matures in early adulthood, they can often treat this. They treat it with growth hormone because that's the problem. They don't have enough. The thyroid gland, located in the neck, regulated by thyroid-stimulating hormones from the pituitary, regulates metabolism, requires iodine. Where do we get iodine? From the diet, but they supplement table salt, yes, with iodine. And just from salting our food with that iodine salt is enough to meet the small but critical demand for iodine. Okay, hyperthyroidism is Graves' disease. Symptoms, weight loss, exophthalmia. They often have like bulging eyeballs. Why they lose all that fat and everything around there and they're up there boing. Because remember, guys, this is hyperthyroidism. So it's cranking your metabolism up. So these people often lose weight. They're just sweating and moving and okay. Treatment, surgery, radiation, antithyroid hormones. Hypothyroid, not enough T3 and T4. Myxedema is the classic disease associated with that. And in children, it can be called cretinism. Treatment, replace thyroid hormones. Again, T3 and T4, and also TSH. The parathyroid glands, found in the thyroid. Remember, there are 4 little tiny. They secrete PTH, parathyroid hormone. Regulates calcium and phosphorus use. It removes it from the bone and puts it in the blood. Calcitonin from the thyroid does the opposite. Deficiency can be due to surgery or genetic defect. Treatment, calcium supplements. Years ago, guys, when they removed a thyroid gland, they accidentally, and they probably still do, some have to, removed some of the parathyroids because they're just little tiny things. They didn't even know about them for a long time. The adrenal glands, located on top of the kidney, adrenal, of course, see, regulated by ACTH, adrenal corticotropin hormone from the pituitary. ACTH deals with the cortical hormones, not the medullary hormones. Cortex produces glucocorticoids, mineralocorticoids, like aldosterone, and androgens. The medulla produces dopamine, norepinephrine, and epinephrine, the medullary hormones. An insufficiency of adrenal function, primarily the cortex, is Addison's disease. Remember, guys, you have to add more to bring it to normal, as I remember it. President Kennedy had this. Cushing's disease is an insufficiency of it. Prolonged use of adrenocortical hormones can cause that. The pancreas. Pancreas is the only gland in the body that's endocrine and exocrine gland. Isles of Langerhans are the tissues that secrete insulin. Insulin is essential for metabolism of fats, proteins, and carbohydrates. Excess insulin produces, if you have too much insulin, it removes too much sugar out of the urine, out of the blood, so you have hypoglycemia. If you don't have enough insulin, like in diabetes, you have hyperglycemia, too much sugar in the blood. Diabetes type 1 only consists of 5 to 10% of the patients. Failure to produce insulin, it's an autoimmune disease in which the beta cells of the Isles of Langerhans are destroyed, and these unfortunate people have to be on insulin supplementation for the rest of their lives. Type 2, of course, makes up the vast majority of it, insulin resistant. And it has a very, very large lifestyle component. Now, it's big time genetic component too. It runs in my family heavily. But also, guys, lack of exercise and overeating and overweight and all that, you're setting the stage for this. There's also what's known as gestational diabetes. Pregnancy-induced, usually resolves after birth. Insulin stimulates carbohydrate metabolism by increasing the movement of glucose and other monosaccharides into cells. Yep, that's well put. That's what it does. Essential for life. Used to treat type 1 and type 2 diabetes. Cannot be given orally. The acid in the stomach destroys the disulfide bonds of the insulin. Preparations rapid-acting, long-lasting, premixed. Oral hypoglycemic. Guys, depending on how advanced the type 2 diabetes is, many patients can take these oral ones. They're not insulin, but they can improve the situation enough to be acceptable. And these are all the different ones. I don't know a lot about these. But once the type 2 diabetes becomes significantly advanced, they often have to go into insulin. And of course, type 1 diabetics have to be on insulin, period. Remember, that's an autoimmune disease. Hyperglycemic agents used to increase blood glucose. May be given orally or by IV. Examples: glucagon, hypoglycemic glucose. And that's it. All right, we made it. All right, guys, go back, study it, learn it, do it, be it. Dr. Tom will see you the next time. Signing off.